Everyone. Thank you so much for joining us today for our first webinar of 2026. We're excited to have you here. There's plenty of you here, and we're happy to see those attendee numbers growing. You guys are ready to kick off the year with some good training content. Today, you are joining us for something that's maybe a little bit different than our normal content because it's not senior focused, it's ACA focused. But we know that a lot of our agents are working in that industry or in that sector of the industry, and there's been a lot of disruption, not just in the senior market, but kind of in the insurance industry as a whole. So today we wanted to talk to you about an ACA alternative plan. That is the ManhattanLife affordable choice plan. Now, my name is Sadie Palmer. I'm the strategic communications lead here at Senior Marketing Specialist, but I'm just the host today. The real star of the show is our sales training specialist, Gio Jones. Some of you might have worked with him in the past, and now his role is really focused on agent training and making sure that you guys are getting the training and the knowledge that you want and that you need. So excited to have him on here. I'll throw it over to you in just a second, Gio, but I have some boring housekeeping stuff. First things first. First thing, today will be recorded, so if you have to hop off, that's totally fine. We'll have this up on YouTube. We also will have a follow-up email for you guys that this recording will be in the next 24, 48 hours or so. We try to get it out as quick as possible. And then also, please feel free to use our question box, our chat box. We love interacting with you guys, makes our job a lot more fun. You get a lot more out of it. But today, because there's a lot of information that we're going to be going over, feel free to throw your questions in throughout the webinar, but we're going to save your questions till the very end. That way Gio can kind of go through all of them. A lot of your questions might get answered throughout the webinar, so just keep that in mind. But feel free to throw your questions in throughout the webinar. We just won't touch them till the very end. Gio, that is all I have, so I'm going to kick it over to you.
Perfect. Sounds good. Thank you very much. Well, I am excited to jump in this with all of you today. We're looking at the ManhattanLife Affordable Choice. It's an ACA alternative. As Sadie had said, I've been to some webinars on this. I've done a lot of research, so really excited to jump into this with you all today and just tell you all about what it is. With that being said, we will go ahead and get started here. All right, so the agenda today, what we're going to go over is we're just going to go over the alternative in general, just a brief overview of what it is, why we're looking at it, how it works, coverage amounts, limitations, and then we're going to break off and specifically focus on the ManhattanLife Affordable Choice Program. So just the brief overview, it is not an ACA compliant plan. I really want to drive this home because it's an alternative. It works differently. It's not going to be considered the ACA coverage. It's not going to function the same. Really, the best way to think of it is it is a fixed cash hospital indemnity plan. You're going to have to go through underwriting. If underwriting is approved, there's still a 12-month waiting period for any pre-existing conditions. And as on most of these short-term medical plans, maternity is not going to be covered on any of the ones that I have looked at. So why are we looking at the ACA alternatives? Well, loss of the premium subsidy is the biggest one, right? That's driving costs up astronomically for people. So it's increasing the overall cost of the ACA coverage in general. What I've done here, and I'll show you some examples. I wanted to keep it pretty basic. Didn't want to go into like family coverage and all that. So I just did 45-year-old male as an individual, and I just pulled up some quotes in my area in Missouri just to kind of look at what we were looking at price-wise. So the first option that I have here as an example, this is the lowest cost ACA plan in my area in Missouri. It is $664.27 a month without the premium subsidy. The deductible itself is $7,500, and that's the health and drug combined. And the out-of-pocket maximum is $10,000. You start looking at the co-payments there. Primary care is $50, specialists $100, urgent care $75. Emergency room is 50% co-insurance after hitting the deductible. So a pretty hefty premium to be paying considering how high that deductible is. Now, I wanted to jump over, and this is the lowest deductible ACA coverage that's available in my area in Missouri. It's $907.50 a month, right? So the deductible is $500 on that one. The health is zero. The deductible is mainly for the is for the prescriptions there, and then the out-of-pocket max is $8,000. Look at the copays; it's quite a bit different. Your emergency room is just $500 compared to the complete cost until you hit the deductible on the previous one. But again, looking back and forth, lowest cost $664, lowest deductible $907. Very hefty premiums there. Right, so let's kind of shift back into these alternatives and talk about how they work. I wanted to show you those costs and those price points just to show like, hey, this is why this is a thing. This is why there is a need for it. Those costs are astronomical. So there's two different types of the alternative plans that I've looked at. We've got the network plans. Now those are going to be simplified. It's not where clients are having to file their own claims. It's going to be similar to the standard insurance model. Typically what you'll see is a PPO network. They can go out of the network obviously with that, but that's going to be more them having to file some of their own claims. We're not going to focus on the network plans today. That is a separate topic that can be a good fit depending on the client that you're working with. The Manhattan Affordable Choice, that is going to be a non-network plan, and it functions quite a bit differently. So in this scenario, you are filing your own claims for reimbursement. You're not handing the insurance card to the provider. I just want to be very clear on that because it's a fixed cash hospital indemnity plan. They're having to file those claims for reimbursement. Because of that, they are getting the cash price, so they're getting a discount. It's significantly less than what you would see typically on an insurance bill, right? The cool thing that Manhattan does is they have the ability to sign off to the carrier to negotiate cash payment. So essentially what this is this is a HIPAA form they can fill out for a claim. They submit that to Manhattan, and Manhattan can negotiate the price that the service is going to cost. I'm kind of jumping ahead a little bit. Once we start breaking down like costs and stuff, I'll kind of explain that in a little bit more detail. So let's go ahead and move forward here. So coverage amounts, the way it works is the client's getting reimbursements and payments set for a variety of different services. The biggest, top one that you're going to see on all these is the hospital daily confinement, but there's emergency room, surgery coverage, office visits. It's a very long list. I'll show that all to you all in a moment here. Those are just the most common examples that we typically talk about. There's going to be several different, tiers. So those coverage amounts are going to vary based on those tiers. And then there's going to be some coverage limitations as well. So now that we've kind of talked about the general overview, let's focus specifically on ManhattanLife's Affordable Choice Plan and how that works. So first thing I want to focus on, there's a lot of information here. I want to focus on the premium calculation. So there's three different factors that can affect this. So if you look on the left side of that chart, you're going to see age ranges, right? So you have got 18 to 29, 30 to 39, 40 to 49, and 50 to 64. Obviously, those prices are going to go up based on the age group, right? So go to the right of that, and you're going to see four different categories for the amount of coverage, I should say. So you can have individual coverage, individual and spouse, individual and children, and individual and family. One thing I will outline here under the individual and children, individual and family, that includes up to 4 children. So there is an option to add additional children for an additional fee, but the family plan and the individual and children plan do include coverage for up to 4 children. If you go up to the top, you'll see there's going to be different classes of the plans. So you've got the Elite Plus, the Elite, the Classic Plus, and the Classic. It used to be that the Manhattan program only had the Elite and Classic, but they did add the Classic Plus and the Elite Plus in there just to give more coverage options. I personally am a very middle of the road coverage person. So when I'm looking at this, a lot of the time, the one that stood out the most to me would probably be the Classic Plus or the Elite. We'll go over some more specific examples, kind of breaking down what each of these coverage entails and what the differences are. So a lot of information on this page. Don't be overwhelmed with it yet. We're going to do a different breakdown after this. So the only thing I really want you to focus on is at the very top. If you look at Elite Plus, Elite, Classic Plus, and Classic, the biggest difference you're going to see in these plans is that inpatient hospital confinement amount. So that's per day that they're confined to the hospital. The Classic plan is going to do $2,000 per day. The Classic Plus is going to be $3,000. The Elite is going to be $4,000, and the Elite Plus is going to be $6,000. Now, again, there's a lot of information here. I have another slide where we're going to break down specifically just the Elite policy and talk about what that coverage is and the main points, just because I know there's a lot of information here. If we shift down to the bottom, this is where the limitations are. So I wanted to talk about what the limitations look like on the policy. So the inpatient hospital confinement, so the amounts that we were talking about per day, that is going to have a limit of $1 million per calendar year that the insurance carrier will pay out. The prescription benefit is up to $750 per calendar year. Allergy shots and immunizations, 100, and then the lifetime maximum for the plan is going to be $5 million. One thing that I will point out before we go to the next page here that outlines the stuff, kind of simplifies it to where it's just not everything all at once. If you look at these amounts, just on any of these categories, you'll notice there's no language here that says up to, right? There's no up to $6,000 or up to $4,000. That's the amount that the client gets, right? So when we were talking earlier about the reimbursements and negotiating with the carriers, the carriers negotiating with the providers, essentially what that would mean is if we look at the Elite plan, and let's say somebody was in a hospital stay for 3 days, right? They're getting that $4,000 a day for 3 days. So that's $12,000. So if they sign that form over for Manhattan to negotiate the rates or the coverage amount that the hospital or facility is charging them, if they negotiate it lower than that $1,200 amount, the client gets the rest of the money. So let's say Manhattan negotiates it down to $10,000, then the client's receiving a check directly for $2,000. So like I said, I wanted to come back to that because we started talking about that earlier, but that's a really cool feature of this plan. Let's dive into just the specifics of the Elite, because that, again, there's 4 different tiers. I want to focus specifically on this one because this one stands out to me the most, is just kind of being middle of the road here. So just to review, that inpatient hospital confinement amount for the Elite was $4,000 daily. The emergency room coverage, that is $300, and they will do up to 2 per calendar year. Urgent care is also $300. They'll do up to 4 per calendar year. So the surgery benefit is 2.5 times the Medicare fee schedule, and that limit is $50,000. So I just kind of want to explain what that is. So what a unit is, which would be 1 unit, is similar to what the Medicare would cover. So this is 2.5 times that amount essentially. So the ambulatory surgical benefit, that's $2,500. Office visits, $175 per office visits, limited to 10 per calendar year. Now the cool thing about the office visits is they do allow rollover. So if the client has the plan multiple years, they can roll over some of those office visits to the following year, which is a neat feature. Ambulance coverage, they're going to cover $150 per ground. For air, they're going to cover $1,500. And again, that's going to be limited to 2 per calendar year. The cancer benefit, now this is unique. Now this is on all tiers of the plan. The coverage amount can vary here, depending on the tier. But with the cancer benefit, $2,000 daily, 40 per calendar year. And to go back real quick, just to kind of focus on that, that cancer benefit is going to pay for radiation, chemotherapy, and immunotherapy per day, 40 days per calendar year, about $2,000 on the Elite plan. So just doing a brief comparison, kind of looking at both of them together, right? When we go to the ACA coverage for the 45-year-old male, $664 for a monthly premium for that high deductible plan that was $7,500 for the deductible. 907 monthly premium for the low deductible plan that was $500 just for the prescriptions. There was not a deductible on the health. When we look at the short-term medical coverage for the 45-year-old male, you'll see how much that coverage differs, and that premium differs, right? For the classic, we're looking at 112. For the classic plus 148, the elite 195, and the elite plus 259. I've highlighted the elite because that 195 a month, that's what this is that we had just gone over, all of these attributes here. And if we go back a few more slides, you'll see there's more stuff that's covered and more of a breakdown. I didn't want to get too much into the details. I just wanted to focus on the main ones here. So that being said, let's kind of shift back into some other aspects of the policy. Underwriting's the one thing I want to go over and just kind of emphasize again. It is fully underwritten. It can be declined. I will say from some webinars that I've attended and looking through the application process and the questions, they do appear to be very lenient in underwriting. A lot of diagnoses in the application will allow an explanation to be considered below. Reminds me of some of the Medicare supplement carriers where you can say yes to a condition, but then you can outline it and discuss it. This has many conditions listed, much more than you would typically see on a supplement. That being said, it is important to be aware of that pre-existing condition clause because there is that 12-month waiting period for anything that's going to be associated with a pre-existing condition. So even if somebody can get through underwriting, if they have some serious health conditions that could be, potentially expensive, then it might be worth considering having them stay on ACA in that case. Again, this is a great alternative, but it has to be the right fit for the right client. And then as we had talked about earlier, maternity is also not covered. So some selling points, obviously looking at that comparison slide with the price points speaks volumes. I mean, that ACA price has just increased dramatically. Preset reimbursement amounts. And I wanted to focus on that again because that's huge. There's no up to language. It's not, hey, we'll cover you up to 4,000 or up to 2,000. They specifically just say the amount. And that's what makes the plan unique when you sign the HIPAA form to have them negotiate those prices with you. In some of the webinars that I attended, there were several people that gave examples of, yeah, I received extra money after my bill was paid because Manhattan had negotiated the prices down. Biggest thing when you have these reimbursement policies, they can go to any doctor or facility, right? So you're having it's a cash indemnity plan, which is cash negotiated prices. Now, again, I want to emphasize what it's not. This is not something that's let me hand you my insurance card, right? This is a lot of work on, I should say, it's more work than just handing your insurance card, right? But again, right fit for the right client, it can be very, very beneficial. Thinking of it as similar to your standard hospital indemnity plan that you would pair with a Medicare Advantage plan. They're not handing that hospital indemnity card to the carrier. They're still having to file that claim. That's how this plan works as well. They're filing that claim, or as an alternative, they're signing that HIPAA form and having Manhattan negotiate the rate or negotiate the prices with the provider, providing payment to the provider, and then providing if there's anything left over to the client. Some closing remarks here. I just want to go over. I really want to emphasize the importance of it being an alternative and not a replacement, right? We said that at the very beginning. It does not meet the ACA standards, and it doesn't function like the ACA, right? Clients with numerous health issues are not going to be an ideal fit, right? If you have somebody that is, number one, they may not get through underwriting, right? If they're having numerous serious health issues. But even if they could get through underwriting, it's not necessarily, it doesn't mean necessarily that it's the best fit because of that waiting period that we had talked about. So that's just something to be aware of. You want to understand what the policy does, but also you need to understand its limitations as well. Clients have to be comfortable either filing their own claims or signing that over to the insurance provider, signing that HIPAA form and submitting that over to Manhattan. One other thing that I do want to mention that's not listed here, but it's another big factor, is medications. Right? If you have somebody that's on very expensive medications, we talked about that briefly, they'll reimburse up to $750 per year for medications. So if you have somebody that's on some expensive medications, that may also be something to where like it may not necessarily be the best fit for the policy itself. Now, I will say we focused on one of the alternatives today. The other alternative that I had mentioned, where you have that PPO card, I know Allstate offers a plan like that. That's something that is a little bit more simplified as far as them just handing an insurance card to provider. So if you have a client that falls into that boat, that could be a potential good fit for them. I will say limitation-wise, coverage-wise, and what is covered, it's going to be similar as far as the coverage and the price points. That being said, I want to kick it back over to Sadie just to see what questions we have on the material that we went over today.
I am muted. First webinar of the year. Got to get back in the swing. We do have a few questions here. You guys will be on we will be on for just a few more minutes. So please feel free to throw your questions in there. Let's see. First question, is there a chart for state availability? We also have a question asking if this is in California. Are you aware of what states this is in, or is there a chart that they can look for?
I believe they do have a chart on their site. I don't have that in front of me right now, so I don't have all the specifics on what states it's offered in, but they do have that provided on their site.
Awesome. Let's see, is the emergency room $300 copay or coverage?
So that's going to be the coverage. All the amounts that we talked about, there's nothing on here that's considered a co-payment with the way the plan functions. It's that fixed cash reimbursement. So any of the amounts that we saw or went over, that's the amount that the insurance carrier is going to provide.
Awesome. The questions are rolling in. That's great. Are the open enrollment dates the same as ACA?
No, so this can actually be enrolled in year round. So that's a unique feature of this one. It's just an insurance plan that as long as they can get through health questions, they're able to enroll in the policy.
Let's see. How does the RX figure into the underwriting, i.e. limitations on number per conditions?
So I'll be honest with you, I don't have a lot of information on what they're looking for as far as like how many medications can you take for blood pressure or, different things. I feel like they're pretty strict on the diabetes, like with insulin. I feel that that's a decline. I'd have to double check and look back on that again. I would just pull up honestly their application. That's what I did when I went through and looked at the health questions. I know not a lot of it focused. I didn't have a lot of information on prescriptions. It was more so just conditions and then outlining, hey, if you had, X number of conditions, like how is that treated? Put your explanation in below.
Awesome. Let's see. Is this HSA approved?
That I am not sure on, actually, to be honest with you.
Yeah.
We'd have to look into that and get back on that one.
Yes, for sure. Let's see. Will this policy complement ACA coverage? So can it be paired with ACA coverage?
It can, yeah. I mean, think of that. If you were doing a pairing like that, that would just be like if you're pairing a hospital indemnity plan with a Medicare Advantage plan. You could absolutely get this in addition to the ACA coverage to help cover some of those higher costs.
I like this question. Why would you recommend? Oh, sorry. Go ahead.
I was going to say, I will say to add to the first one again, just be aware of the pre-existing conditions and stuff, because if somebody has ACA and that's why they have it and they get this policy, there's going to be a waiting period of 12 months before they're going to be able to use it for anything pre-existing.
Yeah, solid point. I love this question from Mary. Why would you recommend this plan over other companies? So why would you recommend this specific plan over other ACA alternatives?
That's a great question. So I think it depends on the client that you're working with. I know for me, it stood out a lot to me because I've filed my own insurance claims before because I've gone out of network and done things. The thing that stood out the most to me was being able to sign that over to Manhattan and have them negotiate the rates and getting those cash rates. I'll provide a personal example here. But years ago, I was seeing a specialist that was out of network. When he was in network, it was billing it at $300. The insurance would break it down. When the doctor was out of network and I could not see him on my policy, I got a cash discount, and the copayment was $100 versus what it would show breakdowning on insurance. So getting that cash discount price is going to be huge. And in the webinar that I attended, I thought it was really neat because there were several examples of people that had Manhattan negotiate those rates down, and the consumer received the additional funds, I mean, thousands of dollars depending on the situation. And I think that's, again, and that's what points out to me not having the up to language. There's a lot of carriers out there that do that up to language. So they just say, oh, we'll negotiate it down, and then we keep the rest for ourselves. Manhattan's like, nope, we're going to pay $4,000. Doesn't matter how much they charge you. We'll give you whatever is left over. As far as if I would recommend this over the PPO version, I think that's very client specific. If you have a client that just you don't feel as comfortable doing that or wouldn't be a good fit, I would lean towards maybe the more simplified option. But if they have the ability to do that and you're confident in that, I would lean this way 100%.
Kind of rolling off this question a little bit, we had another question come in asking, who is Manhattan Life? This is someone who's not familiar with this company. I know that we work with Manhattan Life and recommend their certain products on the senior side, but Gio, what are just some like general thoughts about Manhattan Life? Why do we like to work with them, etc.?
I mean, I would say they've been in the industry for a long time, a considerable amount of time. They have a lot of unique ancillary products, more ancillary products than most carriers. I know a specific policy that I myself have written that I really liked. They've got a very strong dental, vision, hearing policy that's true vision and hearing coverage, I always like to say, because there's not the limitations that you'll see on some other policies where it's up to $200 every 2 years for glasses. And I will say there's two different ones. So they've got one that's like that, but then they've got their original plan that they still have on there. They've got a very, very strong home healthcare plan as well that I've done some research on. They're just very well-rounded overall with their ancillary products.
Awesome. We have some people asking if we can show the state availability chart. What we can do is we can throw that chart in the follow-up email. That way you guys are able to see that. It might be a little tricky for us to pull it up right here. But we have just a few more questions. If you have any lingering ones, throw them in. We want to get you guys out of here in an appropriate time. Let's see. If you want Manhattan to negotiate the billing rates, how and when do you get them involved? Most doctor providers want payment on the spot.
So with the Manhattan, to get them involved specifically, there's a HIPAA form that you fill out and submit to Manhattan. As far as the payment on the spot, I mean, I think that depends on the provider. Sometimes I know in personal experience, I've been able to break things up into payment plans if I've just been able to pay with cash, as long as I'm paying something towards it, and then maybe reaching out to Manhattan and submitting that HIPAA form so they can go over. If you do have a provider that's really strict on that and just says, hey, you have to pay this in full if you're going to see us, I would say, yeah, in that scenario, you can have them pay, you're paying in full, and then I would just file the claim directly with Manhattan if you're running into a situation like that.
Awesome. Is the cash negotiation only applicable when you are out of network if you have an ACA plan?
I think I'm confused on that. So this plan specifically doesn't have any networks. So it's not the typical insurance card. You're not going into the provider and providing them with anything if you have this plan. But when you're asking about ACA, that's what kind of confuses me there. Are we talking about the ACA coverage or the Manhattan coverage?
Mary, go ahead and clarify in the comments if you want. Also, we can just follow up with you afterwards as well. Let's see. Okay. If someone is on a controlled substance medication and cannot see their out-of-network doctor on a cash pay basis due to DEA guidelines, would this plan be accepted by the provider's office as an out-of-network insurance scenario? If you don't know, can we get enough information? Go ahead.
Oh, sorry. I thought that was a question. Go ahead, finish.
Yeah, no. It was a question. Yeah, go ahead.
Yeah, no, I would say so. No, I mean the way this works, it's a fixed cash hospital indemnity plan. It's not something to where you're sending it in in the office. No, there's not going to ever be a card with this policy where you're submitting it to your provider. It's not that type of plan. If you're looking at that type of plan and that alternative coverage, I know Allstate does offer some network plans as an alternative. I believe, depending on the area, network-wise, they work with Cigna, and I think Aetna. I'd have to double check on that. But if you're looking at something more down that road, and that's the type of client that you're working with that isn't comfortable with this option, I would say that might be a better alternative for them.
Awesome. Some clarification on that last question, the ACA and networks and all that jazz. If you have both plans, so ACA and Manhattan,
okay,
is the cash negotiation only applicable if you go outside of the ACA network?
So yeah, I would say that's where it gets a little bit tricky, because you can have both of these plans at the same time, like if you wanted to get this to complement your ACA coverage, but there wouldn't be cash negotiation at that point because you're still running it through insurance. You can still file the claim with the insurance or with the Manhattan and say, hey, I'm filing this claim. I stayed in, the hospital. I was in the hospital for X amount of days, and that's fine because again, it's not standard insurance. It's an indemnity plan. So there wouldn't really be any cash negotiated discounts if they have ACA coverage because they have insurance coverage. They're going through that coverage. You would just be having them file their claims individually. They wouldn't be doing it that way.
Awesome. Hopefully, Mary, that was clarifying for you. Does this work for holistic doctors or integrated health?
So I would say, let me go back to the slide here where it just kind of breaks down. This is what I would say it covers. So I don't know if that would fall under that category or not. I know if they're actually in inpatient hospital, like that's the main benefit of this plan. A lot of holistic stuff I don't honestly think would be covered. Like if you're talking about anything like chiropractic or acupuncture and things like that, I would be hesitant. Now, if you have like a licensed holistic doctor, you may be able to do the doctor's office visit reimbursement, depending on how that stuff goes. I'm not 100% positive on that one, though.
Yeah, that's a solid question. I know that that's something that we have questions on kind of all the time, no matter if it's ACA or if it's alternatives or if it's senior or whatever. But guys, that's all the questions that we have right now. Throw any lingering ones that you have in there. Kind of going off of that, if you have any more questions about this plan, obviously it's still something that it's something that's new. It's something that we're still learning. There's not a ton of information out there, but Gio has taken a lot of time and will continue to look into this plan. So if you have any questions about it, please feel free to call our office. If we don't have it on the top of our head, we will contact ManhattanLife for you. We'd love to do that work for you guys. Let's see, one more question. Is this plan considered credible coverage for someone who will age into Medicare soon?
So I would say I don't know if that quite would apply in that situation, because once you get past the age of 64, like that last bracket is 64, so they can't get the coverage past 65 to where credible coverage would matter at that point.
Okay. And one more question that we will take here, and then we will get you guys out of here. If we are licensed with Manhattan for dental, does this automatically extend to everything else that Manhattan offers?
So Manhattan has the two different contracts. They've got the Manhattan and the CUL. So I believe, I'd have to double check on this. I think this is through the main Manhattan contract and not the CUL. So which is what the dental's under, I believe. Have to double check on that. But yeah, I believe you have to be licensed with the core Manhattan stuff to get access to this one.
Yes, good question. Gio, if you could flip it over to the contact slide,
Yep.
I will go ahead and show you guys a number that you can call. We also have live chat, so please feel free to go to smsteam.net. That is our website. We have a lot of information on there for you guys, but we have that live chat feature. So if you are in between patients, or you just don't have the time to talk, or you just don't feel like talking to another person on the phone today, you can use our live chat feature that's on there. We're happy to help you guys out. We have lots of resources for both the senior market, and we're getting a little bit more for the ACA as well. Check out our YouTube page, but we are here to help you guys be successful. We want you to be successful in all of your avenues, whether it's ACA or it's senior market. So Gio, thank you so much for taking the time. I know that you have spent time learning about this stuff, attending other webinars, gathering as much information, because there's not a ton out there. But this can
There's
be a
not.
product that,
There's really. It was challenging just to find some of the stuff and attend the webinars. It's so any questions that you guys have, please send them to us, because that's not only going to help yourself, but it also helps us as well. I love learning about this
yeah.
stuff and getting into the trenches. So
Yeah, absolutely. And that's why you're in the position that you are. Guys, please feel free to take advantage of our teams. That's what we're here for. People like Gio, they spend their days making sure that you guys know what you need to know and helping you out. And if there's something that you have questions on, he takes the time, like he did with this, to learn about it. So this was recorded. If you want a follow-up email, well, you'll receive it anyway if you registered for this webinar, whether you had to hop off or not. So we will send that state availability chart in there, as well as the recording and maybe some other stuff if we feel the need. But thank you so much, everyone, for joining us. Gio, thank you so much for taking the time. And we will get you guys back to your day. Thank you so much.